everyone. My name is Anazuo Uhiku, and my paper is on the economy of HIV/AIDS. This paper discussed the economic determinants and consequences of the HIV/AIDS pandemic. So, HIV/AIDS is a worldwide issue, so that's why it's a pandemic. However, there was a special focus on sub-Saharan Africa. This paper was written in 2003, so the data may not be applicable to what's happening now. The acquired immunodeficiency syndrome, AIDS, originally appeared on a sizable scale at the end of the 1970s. So before the 70s, HIV and AIDS existed. However, it didn't affect that many people, and it wasn't the pandemic it is today. On the other hand, the scientific evidence on the existence of the human immunodeficiency virus, HIV, a retrovirus which once enters the bloodstream damages the immune system of the host and renders it pretty much useless, dates back to the early 1980s. There have been two types of HIV identified as of 2001, 2003 when this paper was written, and that was the HIV-1, which is predominant in the United States and everywhere else in the world, and HIV-2, which is primarily found in West Africa. So far, over 60 million people worldwide have been affected with the virus, according to the 2001 UNAIDS estimates, and around 40 million people currently lived with HIV and AIDS. In 2001, about 3 million individuals who had the disease died, and back then, HIV and AIDS was the fourth largest cause of death at the global level. There were no cures or remedies for HIV and AIDS, and still aren't. However, there are the highly active antiretroviral therapies, the HAARTs, and they are aimed at prolonging the life of infected people. People have lived 20 years with HIV and AIDS while on this medication. It also partially prevents the mother-to-child transmission by infected pregnant women. So women with HIV and AIDS can give birth to non-positive or negative HIV babies. So right now, the only way to fully counteract and prevent the spread of this disease is from safe sex practices, sticking to one or limiting the number of sexual partners one has, avoiding using or sharing needles while avoiding drugs, and if possible, avoiding blood transfusion. And if that's to be done, make sure the blood that has been transfused has been properly screened. Just to see the extent of the HIV and AIDS epidemic around the world, I have included this table.
Presentation
It's a
thing,
really condensed version of what was on the paper, but I included what I felt was most relevant. Included sub-Saharan Africa, which was this focus on the topic, as well as some other regions of the world that I would like to compare to this, such as Latin America, Western Europe, Australia, North America, North Africa, and Middle East, as well as South and Southeast Asia. According to the table in the article, the number of people living with AIDS was 40 million, and 5 million people were newly infected with HIV in 2001. That was the incidence in 2001. The adult prevalence rate was 1.2, and the percentage of women among HIV-positive adults was 48 million. As you can see, Sub-Saharan Africa has the highest prevalence of 28.1 million. That was well over half, close to 75% of the total prevalence in 2001. The incidence far greater than any other region, 3.4, while North America had an incidence of 0.045, and Western Europe had an incidence of 0.03, with the lowest being Australia at 0.0005. Adult prevalence, as we can see in Sub-Saharan Africa, is 8.4, North America is 0.4, and the percentage of women among HIV positive adults were 55% in Sub-Saharan Africa, which basically shows that there were more percentage of basically all the adults who had HIV and AIDS in Sub-Saharan Africa. There were more women with HIV and AIDS than men. And in North America, it's about 20%. That is about a fifth of people infected with HIV and AIDS were women. So, in order to survey the economics of HIV and AIDS, it involves analyzing the power of individual and social incentives in avoiding the contagion. So, in general, we all know how HIV and AIDS are transmitted through sexual contact, through sharing of needles with infected individuals, through blood transfusion from mother to child. However, the paper really took a different route and explained it in ways that are very interesting and ways that you wouldn't have thought about probably before reading this paper. Basically, it says, like we all know, it's almost always through voluntary activity / contact, unlike other diseases. So, airborne disease particularly, you are likely to contact it without ever going next to a person who has it. But with HIV and AIDS, you probably had an intimate sexual encounter with that person. Not always, but almost. There are two issues of critical importance, which were asymmetric information and externalities. So, from this point of view, what really matters is the relationship between individual choices in a situation of incomplete information. There's the issue of the monitoring problem. So it basically compared transmitting or contracting HIV and AIDS to the Pareto improving economic trade. So the problem of quality of goods exchanged and the uncertainty about one's health. So a lot of times when people contract this disease, they don't really know the person who they have slept with has it. So it's the uncertainty of going into trade and economics. Sometimes you go into a trade and you might know there are risks there, but you're hoping that you will not fall on the bad side of the risk. You can never be fully certain of your risk of transmitting or contracting disease. Then the ability to protect oneself during sex is severely constrained by the inequitable gender-related power relations, economic dependence, discrimination, and social and cultural conditioning in general. This was I took this quote from the paper, and I felt like it was that's like a pretty good wrap up or summary of what this section spoke about. So we all know now from this class and prior presentations that diseases could have economic effects on a country, and there are economic consequences to the high prevalence of HIV and AIDS, particularly in the sub-Saharan Africa. So households are more likely to be in the poverty trap, and the article describes poverty trap as an inescapable situation of poverty in which individuals' well-being is subject to a recurring cycle of crisis and partial recovery, if not to a real downward spiral. And many causes of poverty traps have been detected, such as insufficient investments in health, nutrition, human capital, and productivity enhancing technologies, as well as limited access to financial services, the degradation of local environmental resources, and civic and social disconnection. However, the significance of this is that the interaction gives rise to a path dependent poverty dynamic, in which bad outcomes are self enforcing and the poor remain poor, even if small interventions or chance improvements occur. So, this is one of the major issues with HIV/AIDS in sub Saharan Africa. Um, Also, the agricultural issues such as peasant behavior, land tenancy, and interlinked markets also affects the breadwinners, making them unable to provide for their families. So most of the time, you see the parents being sick, and then the children are unable to live a good life, basically, because they are too young to work or too young to have a substantial means of income. It also affects growth of these children when if their parents are infected and give birth to HIV positive um, offspring. This will affect their growth and exacerbate sickness, and in turn, that just leads to decline in population as well as decline in productivity as well as the market force. The wealth of a nation most times could be synthetically represented by per capita income, and just like the microeconomic issues, which are impacted by HIV and AIDS, the economy on macro level is also impacted. However, the negative effect AIDS has on microeconomics does not automatically determine the macroeconomics and the effect it would have on it. Theoretically speaking, HIV and AIDS could have a positive effect on the macroeconomics. Um, Economic reasoning would imply that if considered exclusively from a demographic point of view, the HIV epidemic could end up being in high well-being on a macro scale because the labor force would grow at a lower rate than aggregate savings. So the high prevalence of HIV/AIDS could result in a higher per capita stock and hence a higher level state of per capita income. However, there were early attempts to estimate this based on HIV and AIDS. There was a study on Malawi, and it was found that to estimate that in 2010, a prevalence rate rising to 11% is likely to cause a drop in the level of per capita income of about 1%, while the growth of aggregate real GDP would shrink to 0.2% over the whole time span. A similar result was found when the study was done in Cameroon, because the proposal before failed to take into account that HIV and AIDS, unlike diseases such as malaria and TB, affected those who were sexually active, and that almost corresponds to the active labor force. So the more active labor force, there wasn't be going to be any income being brought into the economy, and this would affect the economy negatively. The paper stated that it was well established at the onset of full-blown AIDS epidemic in currently high HIV prevalence countries would bring about strain on the public budgets, like we've seen in the micro and macroeconomics. Estimates showed that the annual cost of providing palliative care, prevention of opportunistic diseases, as well as clinical treatment for a seropositive individual living in sub-Saharan Africa was about 360 to about 700. So the governments face a complex allocation problem, and this is where the policy prescriptions come in. The paper mentioned a lot of issues surrounding the prevalence of HIV and AIDS, and one of the suggestions were the government's immediate action. So the three issues that the government faced were defining composition of government spending in healthcare versus others, choosing the fraction of healthcare public budget to be devoted to HIV and AIDS, and fixing the amount of resources to be spent on preventative or curative expenses. So this is a threefold issue. First, you have to decide how much of the budget will be used on healthcare, and second is how much of the healthcare budget will be used on HIV and AIDS. And the third is how much of the budget on HIV and AIDS will be used for curative or preventive measures. So freeing additional resources and putting more focus on healthcare is essential to tackle this issue. And another problem is how much money a poor government could actually spend. It's not about how much of their budget they were using. It just or the fraction of the budget they were using for healthcare was the actual amount of money. So UNAIDS and the World Bank backed a joint program aimed at advising countries on how to insert HIV and AIDS, like treatment and prevention, into the agenda. And they opened the HIPC program. It's poverty reduction strategy papers, and it was only successful partially. Um, the defense of actual levels of the share of the budget devoted to healthcare was an achievable goal. However, only 10% of budgetary savings from the HIPC debt relief devoted to AIDS during 2001. Another policy prescription in tackling HIV and AIDS is possibly developing a vaccine for it. So it's commonly believed that the most powerful strategy in defeating many diseases is vaccines, HIV nonetheless. Um, Hopefully, the plan is the hope is that the vaccine will be widely accessible and effective. However, there are two opposing sides to making such a vaccine. The first is that the transmissible diseases are characterized by negative externalities, and beneficiaries of these vaccinations are often infants, children, and private demand for vaccination is generally too low. Second is that research on new vaccine is global public good. So one side says there's no need because the demand will be too low, and the other side is that it would be a public good because many people could be exposed to this disease at one point or the other. You never know. Um, so a government could choose to rely on property rights provided by other countries. However, pharmaceutical firms rationally expect that because of the free riding problem, countries with large markets for vaccines would have little incentive to enforce intellectual property rights. Before a pharmaceutical firm decides to invest in a drug for a new vaccine, government may promise to purchase a number of doses at the full monopoly price. Big Pharma now is mostly concerned with making lots of money, and quite frankly, a vaccine for HIV and AIDS might not be as lucrative for them. So, in order to overcome this problem, the World Bank AIDS Vaccine Task Force of 2000 recommended that the creation of a dedicated internationally managed fund with a strong commitment to purchase new vaccines should be used to distribute the possible vaccines in poorer countries. So, like I mentioned before, this article focused on the economics of HIV and AIDS, basically the economic contributors as well as consequences of HIV and AIDS on a population. And like I said, it's specifically focused on sub-Saharan Africa. In general, the peak mortality rates were expected within 10 to 15 years, and this paper was written in 2003. So 10 to 15 years was supposed to have seen peak rates in the past few years. And in recent times, like we all know, medicines have been used more widely. The highly active antiretroviral retroviral therapy has shown to significantly increase life expectancy of people infected with HIV and AIDS, as well as reduce or completely eliminate the passage of HIV and AIDS from mother to child during birth. Global action to fight the epidemic is a priority for the whole international community, and I think from 2003 to today there has been a lot of improvement and a lot of action made. Many organizations focus on HIV and AIDS awareness and the education. So I think we've come a long way from when this article was written. HIV and AIDS is still a very serious pandemic and is a concern for the whole international community. As part of the policy prescriptions in the article, they suggested many government action through resource distribution, as well as possible vaccine developments. In the government action, it questioned what principles should guide policymakers when deciding what resources should be allocated to fighting HIV and AIDS, and whether the focus should be preventive or curative remedies. In your opinion, what should the focus be and why? Do you believe they should focus on preventive remedies or curative remedies, particularly in sub-Saharan Africa?